Hi, this is the second video on fatigue. We will start with sleep-related disorders. Sleep apnea has been shown to increase the risk of death due to cardiovascular problems, as well as due to motor vehicle accidents. Apnea is the cessation or stopping of breathing. Sleep apnea is brief interruptions of breathing during sleep, which result in hypoxemia, an abnormally low level of oxygen in the blood. The resulting hypoxemia usually forces the arousal of the patient from sleep. The patient then returns to sleep, but the sleep pattern will be interrupted numerous times during the night. Sleep apnea can be broken down into obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea is the most common type. It results from the intermittent narrowing or occlusion of the pharyngeal area of the upper airway. This usually results in snoring and apneic episodes. Central sleep apnea, less common, is due to neurological conditions, such as brainstem disorders and neuromuscular disorders, leading to reduced ventilatory or breathing drive. Sleep apnea can present with excessive daytime sleepiness and fatigue. Nocturnal problems, such as snoring, choking, and thrashing around. Morning fuzziness and/or headache. Neuromuscular problems, such as learning difficulties, loss of concentration, depression, and actual personality changes. And sexual dysfunction. When sleep apnea is suspected, referral to a specialist must be made. Narcolepsy. Narcolepsy occurs when a patient cannot resist sleeping in inappropriate circumstances, such as falling asleep at work or in a meeting. It presents with sudden brief sleep attacks. Cataplexy, which is sudden loss of muscle tone in the lower limbs that may cause the person to slump to the floor, unable to move. Sleep paralysis, the feeling of being unable to move while drowsy, the period between sleep and waking. And hypnagogic hallucinations, that's hypnagogic hallucinations, which are terrifying hallucinations when a person begins to fall asleep. Narcolepsy usually presents during early adulthood. It may improve at about 30 years of age. There is no cure for narcolepsy, but medications and lifestyle modifications can help manage the symptoms. Medications for narcolepsy include stimulants. Drugs that stimulate the central nervous system are the primary treatment to help people with narcolepsy stay awake during the day. Physicians often try Provigil or Nuvigil, first for narcolepsy. These aren't as addictive as other older stimulants and don't produce the highs and lows often associated with older stimulants. Side effects are uncommon, but may include headache, nausea, or anxiety. Some people need treatment with methylphenidate, also known as Concerta or Ritalin, or various other amphetamines. These medications are very effective, but can be addictive. They may cause side effects such as nervousness and heart palpitations. Some physicians also use selective serotonin reuptake inhibitors, or serotonin and norepinephrine reuptake inhibitors. These suppress REM sleep and help alleviate the symptoms of cataplexy, hypnagogic hallucinations, and sleep paralysis. They include fluoxetine, also known as Prozac. Side effects can include weight gain, insomnia, and digestive problems. Older antidepressants, such as imipramine, also called tofranil, are effective for cataplexy, but many people complain of side effects such as dry mouth and lightheadedness. Sodium oxybate, also called Xyrem. This medication is highly effective for cataplexy. It helps to improve nighttime sleep, which is often poor in narcolepsy. In high doses, it may also help control daytime sleepiness. It must be taken in 2 doses, one at bedtime and one up to 4 hours later. It is very expensive. It has side effects, such as nausea, bedwetting, and worsening of sleepwalking. Taking sodium oxybate together with other sleeping medications, narcotic pain relievers, or alcohol can lead to difficulty breathing, coma, and death. Referrals should be made to a specialist. I hope this helps. Have a good day.